Today is the 1st of December 2021, which means that it's World AIDS Day, a day commemorated by every 1st of December. And this year's theme is all about ending inequalities, ending AIDS, and end pandemics. Now, the WHO, which is the World Health Organization, says HIV remains a major public health issue that affects millions of people worldwide, although the world has made significant progress in recent decades. Important global targets for 2020 were not met due to the COVID-19 pandemic.
Division, disparity, and disregard for human rights have been pointed out by WHO as among the failures that allowed HIV to become and remain a global health crisis. The advent of COVID-19 has further aggravated inequalities and disruptions to services. Global leaders and citizens are being called on to rally to confront the inequalities that drive AIDS and to reach people who are not currently receiving essential HIV services.
Well, to join us this morning on Breakfast Central, we are joined by Gumisai Bonzo, who has been an HIV awareness and prevention activist for more than 15 years. Gumisai Bonzo has also been living with HIV since 1998, over 2 decades ago. And in 2019, she was made one of Zimbabwe's TB champion. And only yesterday, she received yet another astonishing award, the PEPFAR 2021 Heroes and Heroines Award, because of the work she has been doing to save lives for people who are living with HIV and AIDS. Now, welcome, Gumisai. Good morning to you. This is Breakfast Central. Now, tell us how the journey has been in advocating and raising awareness when it comes to HIV in Zimbabwe.
Morning, everyone. It's good to be here, and thank you for affording me this opportunity to talk about my journey with HIV. Basically, you know, when you get to know that you are HIV positive, there's a lot of things which comes into your mind. There's a lot of self-stigma which happens within yourself before we even talk about the outside stigma which comes from family and friends. But for me, it was not an easy journey, but I think one good thing which I managed to do was to deal with the self-stigma first, and then coming out open, living openly with HIV. I think that was the greatest decision that I made, which made me to be where I am today, 22 years living with HIV and having an undetectable viral load.
Right now, Gumi, according to reports and according to what we have, it says that in Zimbabwe alone, about 1.23 million people are living with HIV. And when it comes to inequality, it also says from Zimbabwe now that women are more, there's a higher prevalence of HIV in women than men. How has your message been received within the LGBTQ community in Zimbabwe?
Okay, sorry, I'm just bleeding. You know, it is too much for me. Okay, so I can say that in Zimbabwe, we have made a lot of progress, especially looking at the LGBT community being able to receive health care services without facing a lot of stigma and discrimination. And how we have managed that is sensitizing the healthcare providers on how to treat and receive the LGBT when they come for treatment, to seek treatment, especially early detection of HIV and STIs, treatment of STIs. And I think we have made a very good progress because the Ministry of Health, National AIDS Council is also helping us to make sure that the healthcare providers have enough information about the LGBT community in Zimbabwe.
All right, Gumi. I need to answer these questions because it's quite important. Well, we're still in a pandemic, basically, and combine that with HIV and AIDS. Now, how has COVID-19 affected access to HIV treatment over the past 2 years? And what measures have the Zimbabwean government taken to make sure that there is a constant supply of medications for those living with HIV?
Yeah, for the medication, I think we had enough medication, but the challenge was, you know, with the COVID restrictions, we were supposed to have travel letters, and some of our members didn't manage to have those travel letters. So it was a challenge for our members to go out there and get medication. You remember when there are some members who are not comfortable taking medication where they stay. So they have to travel maybe from another city to another city to get their medication. And also another thing was some of the hospitals and clinics that we have sensitized to be KP friendly, they were turned into COVID centers. So our members were not able to go there and access the services that they needed without facing a lot of stigma. So that was one of the challenges. But for the medication, the challenge was that of traveling to get your medication, and also the transport money, and also the time, and also the fear. There was a lot of fear from our members to say, if I go out, then, the information of COVID was, people were talking a lot about COVID. No one had the right information. So people were just scared to go out in the open. Remember, some didn't have masks, some didn't have sanitizers. So it was difficult for most of our members to go out and seek health services.
Right, Gumi, we apologize for your bleeding nose. We hope it's under control. But can you tell us how life has been living with HIV for the past 2 decades in terms of breaking barriers?
I think what helped me most with my journey living with HIV, it's just living openly with HIV. I don't have stress to say, what if people see that I'm having my medication, my ARVs. I still remember last year, I used to go to this place where you used to drink. Around 8 p.m. when I'm supposed to take my medication, I just put my ARVs bottle on the table when we are having our dinner, and then I'll just ask the waiter to say, can I have a bottle of water? I want to take my medication. And I didn't know I was doing advocacy that time. So there were some men sitting some few meters from us, and they came and said, how do you manage to live with this? You are not even afraid, you are not even scared, you are not even shy to bring out your ARVs. And then I said, this is my life. And then after that, they then said, can I have your phone number? I gave them my phone number. And they said, you know what, I'm HIV positive. I was hiding my tablets at work. My wife doesn't know I'm taking ARVs. And we started discussion from there. Until then, he invited me to talk to his wife, and they are all now on medication. So I think it's one of the things that I've managed to live, and also to be able to face a lot of stigma which happened around me, even at workplace. When I was still at this other organization, the board chair used to come and open all the windows when I was on TB treatment to say, you are going to give others TB. And then I had to educate them on how to live with HIV, even if I was also affected by TB. So I think coming out open is one of the greatest things that anyone can do to live a stress-free life. Because I understand that it's not HIV that kills people, it's the stress that kills people. So for me, I try by all means to deal with the stress.
Right, thank you so much, Gumisai Bonzo, for coming on the program. HIV awareness and prevention activist, Gumisai Bonzo, all the way from Zimbabwe. Thank you once again for your bravery as you live with HIV and AIDS and continue to champion the good message.
Thank you.
Thank you so much. Now, that story is a story I can relate to, Elisa, because I have a close friend who recently passed on from HIV/AIDS, and this person passed on late last year. And the reason, just like she said, it's not because of the ailment. It's actually the stigma and the stress handling this ailment. Nobody knew about this person and the situation because the person kept it hidden. The person was not on the antiretroviral drugs. The person was not doing anything to take care of the state of health. Instead, he was trying to hide it from everybody until it went to full-blown AIDS. So I can relate to this story. I have been there. I was in the hospital with the person, and it was a really, really sad ending. Young person, less than 25 years.
Wow.
Yeah.
Well, so it's 1st of December as we get set to celebrate the festive Christmas season. Today, as always, every 1st of December, World AIDS Day. The theme, end inequalities, end AIDS, and end pandemics.